since we are the first committee to meet after what? The Cubs World Series. So yeah, go Cubs, way to go. All right, now we'll do business. We'll start with roll call.
Here.
Collins. Here. Parker. Here. Here. Here.
Here. Thank you very much.
Denise, we do the pledge yesterday?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you very much. First thing on our agenda, well, I'm very close. First thing on our agenda is the approval of the meeting minutes from October 6th. I have a motion. Moved by, I'm tired, Parker. Second. You all right? Second by? Trenier. All in favor? Aye. Okay, minutes are approved. Thank you. Miscellaneous reports. We have our usual reports in your packet from the Sunny Hill Nursing Home. Various updates about the activities that they've had. Would you like to say anything special, Karen?
No, our craft bazaar and lunches is tomorrow, so stop over. And I apologize to the board members, we weren't able to get you out notice, but our Veterans Day ceremony is today at 2 p.m. So all the pieces didn't fall together until quite late in the process. So, and you're all very invited to come over and share with our veterans at 2 o'clock today.
Okay, thank you, Karen. See, it's good you did have a little update for us. Okay, now we will be moving on to old business. And we have Anastasia here. She's going to give us an update on our heroin problem.
Madam Chairman, if I could maybe be moved down into the lineup a little bit because the rest of my team has not arrived yet.
That is not a problem.
Thank you so much.
And we'll move you to the bottom.
Everyone's moving slow.
Yeah. Okay, so we will come back to the heroin update at the end. With the making a special order of that. Okay. Any other old business anyone would like to talk about, bring up, discuss? No. Okay, moving on. Moving on to new business. Okay, our first item on the agenda is renewing contracts for disposable washcloths for Sunny Hill Nursing Home, and we have Rita with us this morning.
I apologize, I left all my paperwork on my desk.
That's okay.
I'll see if I can follow along on my iPad.
I'm sure you can.
This is a renewal of the disposable washcloths, and this particular one is with two companies, Professional Medical of New Lenox and Medline Industries of Mundelein. Professional Medical holds their price. They will have an increase next year when we offer the final renewal, but for the first 2 years they've kept their pricing the same, and Medline does have a 3% that they stipulated in the bid. And this, of course, is with Karen and her staff approval.
Okay, and why do we have two?
There's disposable washcloths and then cabicide wipes.
Okay.
And the pricing, the quality, they just decided to split the bid.
Okay, that's great. Do I have a motion to approve? Moved by Gould, second by Trenier, all in favor?
Aye.
Okay, that's approved, thank you. Moving on
I
to,
have a question about
oh, sorry, go ahead.
on 1, 2, and 3, aren't any of those items on state contracts?
Because of the usage, the storage issues, I don't know if any of them are. I don't know that we've ever checked that, but because of our delivery issues, we have to have companies that are willing to bring them to the nursing stations or to a stock room. State contract vendors will not do that. They want to ship FedEx or UPS and drop it in the door. So we have very specific stipulations on it. We try to do it with local vendors as well, because then we have a little bit better communication with them if there's issues. We order, sometimes it's a huge order, sometimes it's a very small order. It just depends on the population, but it also depends on their storage. Because as you know, Sunny Hill doesn't have a huge storage area, so.
But with some of those contracts with TCPN, there are servicing agents, which may be the ones that we already use.
I can check into it, but to my knowledge, we've never found any of this on any of the state or co-op contracts.
Okay, thanks. Next, we'll move on to new business item number 2, renewing contract for exam gloves.
This is with, again, it's a renewal for the same second-year period, so there will be an additional year. This one is only Medline out of Mundelein, Illinois, and it is, this particular one has the same pricing for the second year.
Oh, that's very good, okay. Can I have a motion to approve?
Motion.
Moved by Trenier, second by Parker, all in favor?
Aye.
Motion passes. Item number 3, renewing contracts for disposable incontinence supplies.
And this one, I believe, is split as well, but it's still loading. I apologize. Okay, it's with Midwest Medical and Professional Medical and Medline Industries, and that's because there are, I believe, 5 different sizes. Some of them are pull-ups, some of them are the briefs. So it's more of a kind of a diaper issue, so there's different reasons why they split them.
Okay. Sounds good. Do I have a motion to approve?
Motion.
Moved by Trenier, second by Gould, all in favor? Aye. Motion passes. Item number 4, renewing contract for therapy services.
And this one is with Alliance Rehab. This is for the first renewal period, and the contract amount will stay the same. And this one is effective February 1 through January 31st of 2018.
Okay, motion to approve?
Motion.
Moved by Trenier, second by Parker, all in favor?
Aye.
Motion passes. And our final one is awarding bid for medical products.
And this is a new bid that we released. We do it every 3 years, so it had expired, or is going to expire. The bid that we released we ended up with 4 bids returned. One was a no bid from Briggs Medical. So we chose to split the bid to the 3 that responded to it, which are the same 3, I believe, that we did in the previous bid. And we do that just, that we go through and pick the lowest responsible pricing.
For the different
And we
items.
end up saving, by the time we do the split, we end up saving about almost $20,000 rather than awarding it all to one bidder.
All right, that's great that you guys do that, because you can save it anyway, and I could get better pricing, which is great.
Right, and we take the second and third year increases into account as well.
Right, yes, okay, that's good to know. Okay, can I have a motion to approve?
Move.
Moved by Gould, second by Trenier, all in favor? Aye. Motion passes. Thank you, Rita.
Thank you.
I will move on, and we'll bring you up before we adjourn, how about that?
I appreciate that. Thank you.
Okay, would anyone like to discuss, is there any other new business? Go ahead, Mike.
Yeah, I just wanted to mention that, as Karen, about the floor replacement.
Yes.
Do you see any logistical issues or getting things done?
I mean, we're gonna be moving, the first unit that we're gonna be doing has most of the damage, more damage than the other 2 avenues. We'll be completely moving those residents off that unit for safety and moving them into the, what will be open by that point, the last renovated unit, 6th Avenue. So they'll just kind of be temporary, they're gonna go complete stop, lock, stock, and barrel with their staff, because there's a lot of dementia residents there. So you want to, have a continuity of service and so they're going to be moving to 6th Avenue totally for about between 5 to 6 weeks. And then, yeah, and now there is going to be a pre-bid meeting. I don't have my calendar in front of me, but I think it's November 10th for the bidders for the flooring. So,
November 10th, so when will we put the date to get it back?
Well, we expect to release it either today or tomorrow. I'm waiting for some more specs from the architect. So we're releasing it hopefully by tomorrow at the latest. The pre-bid will be next week, and then it's due back on Friday the 18th. It's a very tight turnaround.
And then we let it, before Thanksgiving?
Well, it won't be approved.
But I mean,
Until
but I mean, you pick somebody before
Oh, yes.
then, and then it would get approved at December, so we'd probably be starting in January.
Right, January,
Cause any
February.
issues that time of
No,
year or
we
anything?
won't,
or-
because we don't have an opening date on 6th Avenue yet. The paperwork just went to Illinois
Right.
Department of Public Health, and that takes a little bit, between
Yeah.
4 to 6 weeks for
Right.
those guys to get up here from Springfield to look at the unit itself. So I think we're gonna be fine, plus Christmas, you don't wanna kind of,
Right, so we'll be after that. So
Yeah.
that's why I was worried about if we were starting right during the holidays or.
no,
anything.
absolutely.
So we'll be good.
Right, we'll be good, thank you.
Okay, does anyone have any other new business at all? No. Okay, I know that, I'm surprised my sidekick isn't here today. Herb is usually here. But he's sleeping still?
Sure.
At our last county board meeting, I had Herb read an article regarding a little girl who woke up to go to school. She was 7, got to school, and she told the teachers that she couldn't wake up her mom and dad, and they, sent the police and everyone over, and both the mom and the dad had OD'd on heroin, and there were 3 younger siblings still at home. And he told me yesterday at Forest Preserve that he just read another article, similar story, so it's like, people just need to, if you have a friend that's doing this heroin and you know it, what you need to really do is tell them, you know what? It's, first off, obviously, it's not the right thing to do. But sometimes, you may think you're doing heroin and you're not, and tell them that story. Tell them that story about, if they have kids, tell them that story. Because if they have children and they're using heroin, which they shouldn't be doing, as we all know, but if they are, and you have a friend that is, tell them these stories. Maybe they'll think twice to say, you know what, maybe that next time that I use it, it's gonna be laced with something that I don't know's in there, and I'm not gonna ever see my kids again. And these poor little kids are stuck with no mom, no dad. And then maybe no siblings if they get split. Go ahead, Susan.
Judy, I just wanted to mention, I saw a gut-wrenching video on YouTube, probably about 3 or 4 weeks ago, and it was a mom who brought her 2-year-old daughter, who was just a toddler. They were like in a dollar store or something, and the video shows, the people in the store were videotaping it, with the phones. The mom is laying on the floor, OD, and the little girl, the toddler, is walking back and forth and crying and trying to pick up the mom, and I have goosebumps right now. It was the hardest thing to watch.
Yeah.
And eventually, they did call 911, and the police came and they administered Narcan, and the woman survived.
Oh, wow.
But if
Amazing.
anybody wants to watch a video to kind of scare straight, I'll tell you that's the one. It
Yeah.
was horrible.
And it's so traumatic for the child. I mean, people think a 2-year-old is a 2-year-old, but it's very traumatic. The kids remember things that are traumatic when they're young. We all were 2, we don't remember a lot. But if you live through a traumatic event, it stays with you and impacts your entire life. And it's really serious, and I really wish that our message would get out there, because we do try and bring it. And thanks for bringing that story forward. And I think everyone, at every public health and safety committee meeting we have, if anyone ever hears of something, and even our sheriff's department, if you guys have a recent story you can share, I think we need to tell people about it, because maybe that next story that person hears is going to be the last one that makes them decide, I'm never going to do it again. So let's keep shooting for that. Okay, so that was our other new business. Now we can move to public comment.
We're ready if you're
Are you guys ready? Well, that's perfect timing. Okay, now we will have our heroin update with Anastasia
And Dr. Kathleen Burke.
and Dr. Kathleen Berg. Thank you for coming this morning.
Did you work that last night, everyone?
Good story though.
Yeah. Thank you so much for allowing us to come today and talk to you about this heroin effort. And I want to applaud each of you county board members for really staying dedicated to this issue. You all know how important it is, and it seems to keep getting worse and worse. I'm going to just share with you a little bit of some of the efforts that we've done. We've been very well in communicating. I'll pass some of this around. I don't have one for everybody, I'm sorry, but with the education, with the Robert Crown, you can see on the map that we've reached almost all parts of the county with the education, with the Robert Crown Initiative. And we've been very successful in being able to offer this curriculum through JAG grants that we've been very, very successful in obtaining. So that's a very good thing. Education, we've always talked, it's a three-pronged stool. It's education, it's treatment, and of course it's incarceration of the drug dealers and such. But, you know, unfortunately the issue is getting worse. Kathleen's going to be able to share some more, absolutely, some more detail with you. But what we're currently doing right now is we're working with the Lincoln Way and the Wilmington school districts to get this curriculum offered to their students. They have, they're doing preparations with the teachers in order to deliver it to about 1,600 students. So, I mean, education is so huge, like you were saying, Judy, and unfortunately addiction has just gotten to be such a medical, hard disease to kick, but we figure if we can keep people from even starting, that's half the battle right there, and then the other efforts can all fall in place. And I'll let Kathleen share with you some of the other things we've been doing.
Okay. Can you, yeah, like,
Get your arrows up.
Thank you. Again, thank you for having me here today and to be able to share this information. I've been working with Will County for the last 3 years on, and then when I was at Robert Crown before that, to prevent substance abuse. And unfortunately, the opioids that have been available to people through our through various means, but primarily through the medical care system, has taken a toll on those who are prone to addiction. And so addiction is a medical disease. I want to make that clear right up front, that there are 3 areas that contribute to someone who is more likely to develop an addiction. One is genetics. If you have a gene of addiction in your family, alcoholic, gambler, that makes you much more prone. Second is a mental illness, an underlying mental illness that has been undiagnosed, and that's what we see particularly with our adolescents, that there's depression, there's bipolar disease, there's trauma, things that have gone undiagnosed that folks are self-medicating. And the third is environment. If you live in a family where there is already addiction, or there is already misuse or incorrect use of prescription medications, you know how you have one in your, you have a bottle of Vicodin left in your medicine cabinet that you got when you had a fall or a tooth taken out, and you leave it there because you don't need all of those pills. Well, unfortunately, that's access to someone who is looking for those pills, and so the biggest source of opioids to the addiction is actually in our own medicine cabinets. And so the I know you have a drop-off program always for people to drop off their medications in order to get rid of them and get them out of the house, which is really important. So over the last 2 years, I've been working with the police departments and getting them trained with naloxone. Naloxone is an opioid antidote, meaning if someone overdoses because they've taken heroin, Oxycontin, fentanyl, that the antidote brings them back to life, literally. And in the last 2 years, they've actually developed different types of delivery mechanisms for that antidote. When it first started out, it was you had to give someone an injection, and then you had an aerator where you put on the spray in the nose, and now it's just a regular mechanism that is if you had Nasacort or something else that you could buy over the counter. And so the work that I've been doing is, one, helping the police understand what addiction is, that it's a medical disease. 2, when to identify someone who's having an overdose and to be able to identify them in the field. And then 3, what to do and how to deliver the naloxone and make sure that 911 calls. So I have a few statistics. Since we started the program, we've had 26 deployments of naloxone. 14 of those saved their lives, and they were resuscitated, so to speak. 7 of those unfortunately died, and sometimes that happens because we get there too late. And that the person's been not breathing for a while. Sometimes it's a mixed, it's not just heroin, it could be something else, and they die from that. And now what we're seeing is fentanyl. Fentanyl is killing people. Fentanyl is a stronger, longer acting opioid. and it's being mixed with heroin, and it's also being sold, just straight fentanyl. What I've been educating our officers on, the amount to give is not enough. And so we're learning that more and more. And Pat O'Neill, I've been speaking with Pat O'Neill about that and seeing that there are so many more deaths that are occurring that are bumping our numbers really high. And that's unfortunate. Here we have an opportunity to do some harm reduction with naloxone, but they've figured out another medication that's killing people. And we can thank China for that. Because that's where the Mexican cartel is importing the fentanyl, is through China. It's cheaper, it's easier to get, and that's why it's ending up on the marketplace. Because you want to think, why would you want to kill your customers, right? Well, I haven't got a clue why. Except people are not chemists. They really don't know what they're dealing, and then unfortunately, those who have an addiction are driven by their addiction only, and so they'll take whatever's on the marketplace. There were 3 folks that we didn't know, because what happens in the field, they go to the hospital, and sometimes we don't know what happens. One of the points that I want to make that is we have 57 right now potential deaths, or overdoses, not potential, but overdose deaths. But there are 10 pending that we think are probably fentanyl-based. But what you don't hear, well, you do, but you hear it in a different way. The coroner has his report every year, comes out, and he counts the heroin. But he also counts accidental overdose deaths. Those are opiates that are mixed with other drugs. So in reality, we've had 92 so far, overdose deaths. And we're counting them a different, we're not including them when we think about who's dying in our community. And unfortunately, it's almost 30% more just because we count those numbers differently. And it's coming from pills and fentanyl and a mixture. When people are suffering from an addiction, they will mix with alcohol and other types of medications. And so it's a mixture, and so the mixture is getting very toxic, and we're losing our folks. We're lucky enough to be a community that was identified, unfortunately, because of the amount of disease we have in addiction around opioids, but an opportunity to receive funding around that in order to increase the reach that our naloxone program has. And the federal government identified Will County as a lead county that they would like to be working with us in order to launch a more comprehensive program. Comprehensive meaning not just police, but those folks who are in the community who come in contact with many, many, many people, the families of people who have a heroin addict in their family, to have naloxone on hand all the time. And now it's available through our pharmacies, that's very, very good. And insurance will cover it when you have insurance that does that. So we're about to launch into an even bigger opportunity to do harm reduction, and that's excellent. And I know I talked to the superintendents of the school area about making sure that their education is also, the curriculum is also aligned to do prevention throughout. So, so you're a progressive county. Unfortunately, a progressive county with a problem that we need to keep addressing and keep plugging away and making sure that we use our best knowledge and proven methods of approaching this issue.
What is with the education? What is the response you're getting back from it?
Well, we've had reports from Robert Crown that say that the kids are learning about the education, about the drugs and everything. But the problem is, I think in the last coroner's report, the median overdose death is like 25 to 35.
Right, they're not.
So I mean, it's not school-age kids. I think the school-age kids are getting it, and I think it's still an important prevention part that we need to keep. Another thing I'd like to mention is that we're already beginning to plan for our next annual forum, that we do those Hero Help forums every year. And we want to continue to dissect the Heroin Crisis Act, because it was a big blanket legislation that they put out for the prescription monitoring, the access to treatment, the expanded prevention efforts, but we still want to kind of dig down into that and see what's being done. There's supposed to be a statewide prescription monitoring program, and I'm not even sure if that's being fully implemented yet, or
Pieces of it are already in place, and it's really making sure that physicians participate in it. It's not so much that it's not there, it's participation. So there's a lot of education going on around that.
Yeah, so unfortunately, this problem isn't going away, but I am very happy that we are still, as Kathleen said, we were out in front of this before anybody was. Because our coroner, Pat O'Neill, began to notice that there was an increase in overdose deaths. And he brought it to the attention of the county executive, which, you know, kind of filtered down through you guys. And we really kind of rallied the troops and got things together. So, but there's still a lot of work to be done, unfortunately, so.
And so what do you think the key is to reach 25-year-olds?
Well, first of all, when you think about those who are already on heroin, then what you need to focus on is excellent treatment. And unfortunately, the manner in which treatment is reimbursed is short-term and not treating it like a chronic illness that it is. And so I actually work with a treatment agency that is able to extend and prolong the amount of time that a client is with us because we don't accept all HMOs and things, but when you have an HMO, the HMO is telling you what to do. The other thing is, when someone is addicted to an opioid, sometimes they need to leave the area. I mean, especially the 20-year-olds. The 20-year-olds, when they started using, they started in their teens. When you start in your teens, developmentally, you stop growing. So they are not prepared to launch a life. And so a lot of things that we teach in treatment is life skills, being able to get a job, being able to have a place to live, being able to buy and make your own food, which seems to be a real problem with gentlemen these days, but no comment on that. But, and do your laundry, and do the things that you need to do to have a successful life. And many of these kids have felonies on their records because of stealing or something. So the movement now is to keep them out of the criminal justice system and to get them into treatment. Because once you have that felony on your record, you really are prevented from having a completely fulfilling life and being access to work.
I just wanted to ask, is there anything being looked at for like long-term life treatment? I've seen young people go through the hospitalization programs and the halfway houses and even going away for as long as a year and then coming back and still going back to the drug. There's something missing, and maybe this was just an unusual case, but I just feel like there's something missing.
No, it's actually really common. So recovery is considered a lifelong project.
But there doesn't seem to be coverage for insurance purposes.
So there's not. Once you're out of the acute care system, there is no coverage. And so what we're working on is wraparound services. So the ability for people to, one, bond with other people who are attempting to remain sober. So the support groups, the AA programs, the NA programs, and again, the treatment program that I work for, they identify those programs early in recovery and get them connected with it. They get a sponsor before they're even out on their own, because if you don't establish that. But sober living homes, all right, places where people can live with people who are maintaining their sobriety.
As a permanent way of life?
For a couple of years, yes.
Okay.
Absolutely.
I hadn't heard of that yet.
Yes, absolutely. And those are really successful, the ones that are not unethical, but the ones who are successful, it really makes a difference, because it's like living in a fraternity or sorority with folks who are working for the same things. And so when you're having a bad day, or when you're queued up and something sets you off, physically, the addiction, the cravings, then you have people that you can turn to. The other thing that's happening is medical assisted treatment is on the rise, and we have new medications that are helping. And that has been the most effective preventing relapse with opioids. So you've got Vivitrol, you've got Suboxone, and you have methadone. And they are the most effective treatment that we have right now, with therapy, not alone, but with therapy, for keeping people sober. It's not an easy disease.
No, addiction is very hard because it's like when I have a craving for chips and salsa, I must have it now.
Exactly. You know, and when we teach kids, I try and teach them that it's like, if you like chocolate cake and you want chocolate cake, you're going to get your hands on chocolate cake. But if you're allergic to chocolate cake and you eat it and you have a reaction to it, you're harming yourself, but the craving is stronger.
It's still there, right?
Yeah.
Right.
What school ages are we teaching or talking with?
The school age is middle school and freshmen. And now here's one of the things that, and I told the superintendents this, that in order to be effective with education, you can't have it just 1 or 2 years. You have to have it every single year. And you can integrate it into other classes like science and psychology or other classes, because some kids just tune out health class. You know, it's like, I'm not listening, this isn't for me. Or they have 1 6-week period and then that's it. And so ideal, if you have a progressive community, then you work to make sure there's something about high-risk behavior in every single year. It's not about drugs per se, it's about behavior and making sure that you give kids the tools so that they can resist high-risk behavior that's going to kill them, basically. And you know, kids as they're getting into their teens are supposed to push boundaries. They're supposed to you know, make us crazy. And, but we wanted them to make us crazy in a healthy way, unfortunately.
Right, right. Go ahead, Mike.
Along those lines, are there any written guidelines now that school districts can look to see what some of those suggestions are?
Well, what they look for is evidence-based curriculums. And there are some evidence-based curriculums out there. Schools are mandated to do a lot of things, and often until it's mandated, it's not going to happen because they are so tight with time. So, right. So your superintendents agreed to a survey to find out what's actually, to start the step. What are we doing? What are we doing right now? Because where's your gap analysis? You know, what are we doing and how can we fill in those gaps? So I think, and yes, there are guidelines. There are guidelines in the social emotional area for a lot of those guidelines direct the kind of risk prevention that we're trying to talk about.
So are those getting disseminated out there? I mean, can we get that kind of stuff to our regional superintendent so that he can start?
Well, that's what I'm planning to work with them on, yeah, because they expressed an interest of knowing what's out there, and then it's best the school come up with the manner in which they're going to address this problem. It's really much more effective. And so what you need is the dialogue and the conversation, and that has started at the superintendent level, which is where it needs to start.
And I have spoken with several of this districts that we have offered this curriculum in, and they are still using it, and they're modeling it into ways that it fits in with their curriculums, which is good, like through science or health or psychology or whatever. So it wasn't just like a one and done thing. They are kind of massaging it and making it fit to their particular curriculum and students, so.
You know, what I was thinking is that, you know, when I go to your forum every year, I notice that it's, what I find the most compelling are the artwork that the students do, as well as the setup of, you know, of all the pictures of the people who have passed away with the candles. It's very, it's amazing. And I'm wondering if we have like a traveling type of program where that program goes to the different high schools, at least in middle schools, at least the ones that we have. We could do something like that where we start at whenever we have in the forum in the spring, and then from there it just travels to the different areas.
Well, that's another thing that we're working on too. In addition to having our big annual forum every year, we want to have smaller, little localized groups in these areas, because we've found that those are really effective with reaching the parents and the families. And I'm telling you, hearing a testimonial from somebody that has recovered or somebody that has lost a family member from heroin is very, very compelling. And those are very, very effective. And you guys have also heard about like the in plain sight trailers where they have like a kid's bedroom.
Right.
And they show you where they can hide the dope, and it's like right there, and why didn't I notice that? So those things are very realistic, and that kind of makes people identify to it. Because when you're sitting there and people are quoting all these statistics and stuff, you're thinking, oh, that's not me. That doesn't affect me. But I mean, it affects all of us. Any one of us can be affected by this.
Right, and anyone who has a child, it's very hard because you think, oh, maybe it's really not going to lead to that, or you feel that you're out there alone because your friends aren't sharing the information. They might have a kid or a cousin or whatever relative that had the problem. So it's really hard because it's like you're embarrassed by it. But you really shouldn't be. You should be able to get out there and try and help each other and be there because it is an addiction problem. And it's something you're compelled to do, like with me at Chips and Salsa. So, I mean.
And we've said for many years that the face of heroin has changed. I mean, it's not somebody in an abandoned building shooting up or whatever. It's your friends, you know, on the football team or something that with prescription drugs. They had a knee injury.
Right.
They got addicted and they turned to heroin. I mean, it's just very, very chilling.
Right, very chilling.
Some of the impact that needs to be made is on the physicians and the physician prescribers, and also physicians, internists, to identify potential problems early when they're doing their physicals with the kids. And there are questionnaires that they can go through and they can ask and they can get information to be able to monitor that. And that's a hard sell because everybody's very busy and it's hard, but the physicians themselves are starting to work on that, and they're analyzing what they can do, because there is a direct correlation between when Oxycontin increased and started on the marketplace and the number of heroin deaths. I mean, it's direct, and so we know where it came from. You provide the source, and then it was viewed as a non-addictive drug, and that was not true. And
Right.
But I want to make a point about kids. When you're teaching kids, what you and I respond to is not what kids respond to. So we have kids, I call them kids, the 20-year-olds, who are losing their friends, who've been to 5, 6, 7 funerals of their close friends that they grew up with. That's happening over and over and over. But if they have an addiction, that doesn't help them stop. With younger kids, or the teens, developmentally, showing them something that may happen to them in the future doesn't work, because they don't have that mindset, and they view they're going to be free of any problems. You know, nothing's going to happen to me because they're like Teflon. It's just going to bounce right off of you. So that's why teaching the science and teaching them how to make decisions in tough situations is really critical, because that's what's going to make a difference. That's what's going to make a difference between being at a party and somebody offering you something, or going to a doctor and having them prescribe a lot of pills for you. You know, you need to be educated and say, I don't need those. You know, like, don't. It's dangerous. My friends are going to want them. You know, it's like, please don't give those to me.
Yeah,
So.
you're right with what you're saying with that. That's true. I have my youngest was in behavior school when he was little, and it was just a different way of teaching him how to react, how his body felt in different situations, and what was the right thing or the wrong thing to do. And so, yeah,
Exactly.
thinking on that, it's the same thing. He changed his behavior just in acting out.
Yeah.
These kids, same thing. They need to make sure their behavior doesn't lead to that.
Right, and it's all normal developmental behavior, but it has consequences, so
Right.
you need to teach them those consequences. And they're smart kids, and they love to learn about how their bodies work. They also like speakers who come in and really tell them what's going on. You know, there's really good speakers in this area that can get to the teens, the older teens, because it's powerful, and they speak very from their own experience. But that doesn't sustain. I mean, that's right then, right now, but it doesn't sustain.
Right. Yeah, that's the age.
Madam Chairman, if I could maybe yield the floor to our
Sure.
coroner, Pat
I saw
Nielsen,
him
we
walk
can
in,
give you a
sure.
bigger update.
Thanks for coming today, Pat.
Well, on a happy note, congratulations to all of you house families.
Thank you.
And that's your White Sox.
Yeah, right. On a sad note, an unprecedented amount of fatalities associated with heroin. So I signed out our 58th fatality yesterday, and we have cases pending for tox, of course. There's 9 more, so we're going to be close to 67 fatalities. I would just say that the scenes are very suggestive of a heroin overdose on those 9 cases. So, and we really haven't been wrong yet when we see those situations. So we could be on pace for perhaps 80 heroin-related overdoses in the county. So we have we put our statistical data on our website. If anyone's interested in looking at it, it's on the county website. We get calls almost daily. So that's why we decided to put it out there. A lot of folks are appreciative that we put it out there. Many of the media outlets, they don't have to call us, they don't have to bother us, they don't have to waste our time, we don't waste their time. It's out there, it's updated every Monday and Tuesday. I saw a news release from an Indiana coroner where they had 9 fatalities in 8 days. I think we had 5 in 7 days. So I mean, we're and that was just about a week ago. So it's definitely at epidemic levels. Some of the things we're seeing in the tox is also unprecedented. There's analogs that are being mixed in as like a booster with the heroin, and those analogs are only increase the likelihood for fatality. Some of them are 10,000 times more powerful than heroin by itself. So it's like cyanide.
Right, and someone taking it doesn't even understand that.
They don't understand. There's no patent on heroin, so who really knows what they're getting, you know? And Kathleen may have alluded to this, but outside of just of heroin, the other top category is just the opiate pain medications. I know she mentioned oxycodone and hydrocodone, which is Vicodin, and methadone, and they're all being abused, and that's probably the number 2 as far as overdose deaths. It's right there. It's right running right side by side. So we have that data available as well. So there's definitely a correlation between the pain meds and the heroin overdoses. There's definitely a correlation. A lot of it starts with the prescriptions.
Right.
A lot of it. So.
It's sad news. I'm glad you guys did bring it. I'm glad you guys are putting it out there. I'm very glad we have our videographer here today so that we can take the taping of this meeting, which has so much information, put it out there, and then hopefully people will go to the website and look for more information, because sometimes you just need maybe somebody to point you to it, to give you a hand, or maybe where do I go for help? And if we have that information available, somebody can make a call and hopefully get on the track so that we're not having more and more, because we've had a lot. How many more this year compared to last year?
Well, 53 was in 2012, and then last year we had 53, so it tied that, fatality number. But like I said, we're going to be way over that this year. I mean, it's straining on the office, on the staff, on the budget. It's probably going to cost our office $100 grand just on these heroin deaths.
Right.
It's going to be $100 grand.
Right.
But you don't see that in your budget.
Yeah, right.
Right.
I mean, there's no crystal ball. How do you budget for it?
You can't budget
Guessing.
for that, right? Yeah.
It's a guessing
You can't
game.
budget for that.
And not to mention, it's going to be interesting to find out how many people our law enforcement people have saved with Narcan. It's a pretty hard task to actually figure out how many people the paramedics saved. But truly, we could have a heroin fatality every day. We could have over 300 a year in this county if it weren't for Narcan. I'm a firm believer, and I think that with that reversal medication that's out there, there's got to be 1 or more saves a day with the paramedics, or now even law enforcement that's carrying it. And the other counties are I mean, it's like a whole city is getting wiped out just in the collar counties.
Right.
There's hundreds and hundreds, and Cook County's got to be at 600. They got to have 1 or 2 a day.
Yeah, and that's something that you don't hear on the news. You really don't hear it on the news. You're really not aware of that fact. So.
Right.
But that's the difference. You live in the suburbs, you're not supposed to have this problem.
Right.
In the city, there's this tendency to believe that, oh, it's okay, it's just the city, it belongs there, kind of concept. It's not right, but.
Not a big city drug.
Right. Actually, they just launched an initiative that started last week, Cook County, because Cook County includes some of the suburbs, but also on the west side, they've seen a big jump in fatalities because the heroin is toxic. I mean, you know, it's laced with premise, so it's causing, now it's getting more attention. But it absolutely is spreading. I mean, we're the Midwest center spot for heroin right now. So, and the DEA has come out and said they cannot arrest their way out of this. This is not, you know, supply is not where you want to put your focus. You want to put your focus on demand.
Definitely. Well, thank you guys for coming again. I appreciate the information, and I know that it's very important. I certainly hope that there's somebody we reach today. There's somebody who's going to hear. We have a reporter in the room, hopefully, and somebody else who might hear it online, and maybe we save one life with it, which would be really awesome.
It would.
One less person that you see, Pat, would be great. Yeah.
I hope that somehow, some way this could just end.
Yeah.
I mean, what the solutions are, you can stay up all night thinking about solutions every night. It's just trying to pinpoint what the right one is.
Well, I think a lot of it is to the prescriptions. I know when my daughter had her wisdom teeth out, she was given a prescription for it. She didn't need it, but it was a prescription for I forget how many pills.
Right.
You know,
It's probably
or maybe
30
a
with the
parent goes,
refill.
gets it refilled just because, in case, and then it sits in the cabinet, like you say, and then a friend or somebody comes and it's gone, and you don't even know it, so. Nick, you wanted to say something?
Make a couple of logistic comments for the committee. Next week at Executive Committee, we're going to be bringing forward the Robert Crown's contract for next year. And one of the things we discussed when we brought that originally to the Judicial Committee was to, you know, when we're doing these education programs, what is the follow-up, what is the sustainability? And I'm glad to hear Anastasia mention that some of the schools are continuing this, but when we talked to the superintendent of schools and Kathleen had talked to some of the superintendents, there is that concern that this gets lost in all the other requirements, and having somebody chase this issue is important because the students are dying, they're not learning, and we need to stay on this issue because we know it's such a big problem in Will County. So we're expecting this grant. We know we're getting it. We haven't received all the final paperwork that we've mentioned before at this committee, but that grant's going to have specific requirements that we're going to be scope of work for that grant. We may be looking to do some other things in addition to that work to chase the schools and make sure that the education component's going forward, because that's something board members had said, you know, we want to make sure we're investing this money, the JAG money, that it's not a one and done deal, that we're getting, you know, that we're making sure that the program continues so that there's not just 1 year of education and it stops, but that we keep it going. And maybe there's other education opportunities beyond schools, because as we're hearing, it's 30-year-olds, it's 30-year-olds who are overdosing. The other thing is that just for committee members, because I know a couple of districts are represented here that we haven't done this program, our hope is that we will continue to roll this out in the Homer, Lockport area and out in Eastern Will County. That's why we're engaging the schools now, because they're more single districts rather than consolidated districts. We've done the bigger districts first, but we're going to try to get to every area of the county and then sustain it. And then the last thing I wanted to mention, is we're working on getting some more information, but we've been a lot of talk about the prescriptions. I heard a number quoted recently that the United States, there's 14 billion opiate pills produced each year. And that number is set by the federal government. And for the first time, they did a 25% reduction in the limit of how many opiate pills can be produced. That's a start, but we heard this at NACO, we've heard it other places. That's the problem. People get prescribed 50 pills, 80 pills, whatever, and they use 3 of them. Well, then they've got the rest sitting there. And it's this mass production of these pills and the mass availability which is contributing beyond just the heroin, but it's the opiates. And that's where the grant and these other efforts are going towards. So we're going to have more efforts, but I just wanted you aware. Next week we'll be approving the grant or the contract for Robert Crown, and when we get this grant, we're probably going to look to widen the scope a little bit beyond the grant so we can do some other things, and we'll bring that to this committee and probably judicial, or wherever else we need to go. So.
Anastasia, I have one more question though too here.
Sure.
You mentioned that you guys do middle school and freshmen and high school, and so, but you say the median age is 25. So my question is, why don't we do something in the college, junior college level?
Well, with the prevention efforts,
we feel like that if we get them the education and the information early, then they're not gonna make those choices. But I mean, I guess maybe there could be opportunities that we could,
You know, harm reduction that's what we need to do with the 20-year-olds. We need to make sure they have naloxone, and their families have naloxone, and then we need treatment, and we need availability of treatment, because the prevention goes on early, it doesn't go on later. And the colleges actually do take this very seriously, because they don't want people dying on their campuses. And I trained all the campus officers with naloxone also, and they refer people then into treatment. Alcohol's a huge issue for them too, because of all the binging that's going on. So that I think your point about making sure when we're talking education that we're going cradle to grave is appropriate, and that it just needs to be expanded in that way. But as Nick said, we're trying to get as many of the schools first before we expand out.
because it's easier to reach those kids, because they're in school. The 25-year-olds, not all of them are in college, they're out working or whatever. But you know, one thing that I would like to mention to you that I have always found very interesting is, you know, I don't know how many years ago they changed the legislation where that prescription drugs could be advertised on television. And now you hear all these prescription drugs. And I don't know if there's a point-to-point correlation with the increase in prescription drug abuse, but I just think that that's got to be something.
Sure.
Because, you know, you hear this, oh, if you feel blue, or you can't tell if it's day or night. I mean, there's a pill for everything. And I think our society is just so conditioned to, you know, feel no pain. I mean, doctors are evaluated on that, on their pain management. That's the first thing.
Oh, they changed that. They
did
actually
they?
just changed that, yeah.
Fantastic. But anyway, I just think that there's a pill for everything, and you know, there's just so much work to be done. It just gets very frightening. And you guys, I've mentioned before my personal thing, because I have kids, and we all have kids, grandkids, you know, neighbors, and I mean, it could be any one of us. It could be any one of us, just by the grace of God. I haven't been affected, but you know, so I do really appreciate you guys keeping the attention on this.
Well, I'm glad to have you guys come. Whenever there's something significant that you guys want to bring forward, let us know. We'll make sure you get on the agenda, because I think it's important to put the information out there. Because like you say, education is key. So if we provide this bit of education and somebody hears it, maybe it's a positive, and we can move forward with somebody who might be listening today, sitting home saying, oh, you know, I think I could help with that. And they could contact probably you, Anastasia, or Pat, easier than Dr., you know. But it's so, I think it's a good thing. I want to thank everyone for coming. Great bit of information.
Go Cubs.
Go Cubs, yeah. I think they're going to rest a while now. Okay, so we are on to public comment, I think. Does anyone have any public comment that they'd like to make? Any public comment? All right, no public comment from there. I do not have a report or announcements. We do not have executive sessions. I'll have a motion to adjourn. Moved by Gould, second by